Anxiety is a word we're hearing more and more about these days. We've got Dr. Karen Gordon here with us to discuss it, what it means, and potential treatment, how you can help us out with it. So what is anxiety?
Well, anxiety is an emotion. We have hundreds of emotions, but it is becoming incredibly powerful. And so what I want to really help everybody understand is how it really impacts us, and most importantly, what we can do about it. Okay, and the stats are pretty staggering. It's really interesting. University of Toronto says anxiety is the #1 mental health issue in America.
Really?
Yes, #1.
Okay.
This is it. Like
That's huge.
It's huge. It's huge. It's always been around, but what's different, it's spiking. And you know, when I started my practice years ago, 23 years ago, it was at a medical office, and 23 years ago, I remember working with 3 physicians, and we just started seeing it go like this 23 years ago.
Okay.
And now it's like one of the most common things that we actually see in our counseling office now. So they basically say 41% of the population are struggling with it. 58% of employees actually say chronic stress will actually affect their performance. Millennials are 2 times more likely to actually ask for stress leaves. And actually what's interesting, entrepreneur groups, which is interesting because right now we're seeing a lot of entrepreneurs, it's actually spiking. University of California actually says 50% of entrepreneurs have massive anxiety.
So it seems to be like it's almost like the phrase, like the word bullying. It's becoming sort of this catch-all.
I would totally agree with you.
And a lot of people are, you know, just sort of throwing out the, well, I have anxiety. I have anxiety. Like, what does that mean? Does it mean? Does it mean you're nervous about life? Are you nervous about a certain situation? Are you stressed? Are people getting you down? What is it, and why is it on the rise?
So stress is different than anxiety. Okay, so stress is like, I have an exam tomorrow and I'm not prepared. I'm feeling stressed.
Right.
Okay. Anxiety is different. Anxiety tends to be more future-based.
Okay.
Okay. It tends to be something that could happen.
Yeah.
What if I get this job? What if I don't get this job? What if I don't do? What if I don't get a promotion? What if I don't get into school? And so it tends to be more future-based.
Yes.
And the focus is something that you cannot control.
Right.
That's the key. Okay, where stress, like, oh, I've got an exam tomorrow, I need to kind of make sure I get myself do something right now. Anxiety is different.
Yeah.
And so it's so important that we understand it, that we know what we actually can do about it. Because I totally agree with you, Tracy. I think people are overusing, like, I got anxiety, I got anxiety. And then we're like all like, you know, we're all kind of freaking out, going, okay, so we got to learn how to deal with it. And this is the issue. We have to properly equip ourselves and our children on how to manage the emotion. Okay,
so not take it away, manage it.
Manage it. Okay, so tip #1 is I want you to understand with what causes it. Okay, so bear with me. This is a little psychology lesson.
Yeah.
So our thoughts drive our emotion.
Right.
Okay, our thoughts drive our emotion. So if in my thinking is like, what if I don't get this job? I'm going to feel panic. So the anxiety is not the problem. Anxiety is getting a lot of bad PR. Anxiety is doing its job. If I tell myself, what if I don't get this job? I'm going to panic. So it's the thinking that is toxic, not the emotion.
Okay.
Which is why you should never tell someone you shouldn't feel anxiety. A person cannot just turn off their feelings like a light switch, but they can change their thinking. Does that make sense?
Yes,
okay,
it does.
Everyone's like, yes, now we're understanding it. Okay, so that's really important. So when we talk about managing emotions, what honestly, probably 90% of the work that I do at our center is around helping people really understand that anxiety is not the problem. It's your friend. It's there to help you, and it's telling you something is a little off. You've got to get your thinking in a healthy space.
Okay.
Does that make sense?
That makes sense.
Okay, that makes sense. And this is why anxiety is a good thing. It's not that it's a good thing. It's that it's a sign.
It's your warning.
It's your warning. Thank you. It's like almost like you're playing a sport and you've got a referee going, oh, something's a little off. You want to pay attention to your anxiety to help you.
Right, and maybe to help you switch your thoughts?
Exactly, and that's it.
So you need to pay attention to the thing that is fueling that, which would be how your brain is working and how you're thinking.
And this is a really important thing. When I worked at the medical center with the physicians, they would say, go see Karen first.
Okay.
If you have anxiety, go see Karen first. Learn how to manage it. Learn how to get healthy thinking. If that doesn't work, then come back.
Yes.
And we'll deal with if there's a medical issue. But very few of my clients needed medication.
Okay.
Very few. Not saying that some people do. Absolutely, hands down, some people do. But I want people to realize that there's a lot of things you can do sometimes without it.
What can you do without it then?
This is the thinking, right? And so whenever I work with someone with anxiety, I will work with their physician. Because there's a physical side and there's an emotional side. I will work on the emotional side.
All right.
Okay, and part of that is in terms of actually really helping them in terms of thinking. Okay, so tip #2 is understand the performance anxiety, what I call the lie, okay?
Yeah.
And so what that is one of the toxic thinking that's actually inside the head is I'm okay if.
Right.
Fill in the blank. I'm okay if I achieve. I'm okay if I get this mark. I'm okay if I get all these likes on social media. I'm okay if. And so what happens is a person feels like it's like a puppet. That's toxic. If we feed ourselves toxic thinking, we will feel massive anxiety.
So what would you replace that thought with?
Excellent question. So you can't erase thoughts, you have to replace thoughts. So just think to yourself, what would you want your daughter to tell herself? What would you want your best friend to say? And my guess is you'd want to say, you are okay, period.
Regardless.
End of story. You are loved, period.
Right.
End of story. There's no ifs. I don't love you if you get an A. I love you, period.
Okay.
That's what we have to change it to. So what's happening is we're putting all these conditional statements on ourselves. That's the problem. And anxiety is the outcome of that.
Very interesting.
Is that it? So you have to make sure that we really, just, you know, we think about all the work that we're doing about good nutrition, good exercise. This is what we call good mental health.
Right.
Really good mental health is making sure that you're feeding yourself really healthy, nutritional, emotional
Thoughts.
wisdom. Yes.
All right.
I'm okay, period. I am loved, period. If I get it, awesome. If I don't, I'm disappointed. But my self-worth does not.
Okay.
Exactly, Tracy. And that's kind of like the main part to it.
You say focus on what you can control.
Yes, and so this is another really big part. So with anxiety, usually the person is focusing mentally, they're focusing on what they cannot control. They're focusing on whether or not people like them. They're
Can't
focusing,
control it.
Exactly. You're focusing whether or not you kind of get the job. You can't control it. So one of the biggest things is you want to make sure a person focuses on what they can control and accept what they cannot control.
These are great tips. We need to revisit this,
We
obviously.
need to revisit this. This is such
again
a,
and
this
again
is a
and
huge
again.
topic.
So
Yes.
this has risen sort of with social
Massively.
media and with all those
Yes.
things that we're tied to.
Yes.
So we will have more on this. Thank you, Dr. Karen Gordon.